A very warm welcome to another edition of your favorite program, Health Affair on AIT. On the platform, we focus on critical health issues and the challenges of women and children with a view to finding lasting solutions. I'm your regular anchor, Ushuomowa Daniels. Today on the program, we shall be discussing about sickle cell anemia disorder. It promises to be very interesting, so please don't go away. We'll be right back after the news segment.
As Nigeria celebrates the 2021 Cancer Survivors Day, more health experts are calling for greater collaboration to improve on cancer care and defeat the disease. The National Cancer Survivors Day is celebrated first Sunday in the month of June every year to stand in solidarity with all cancer survivors and those currently battling with the disease. According to the World Health Organization (WHO), every day Nigeria loses over 200 lives to cancer, most of whom are unknown and unsung. It also noted that about 50 million people are currently living with the disease worldwide. Cancer cuts short lives, hopes, dreams, and destinies, leaving behind gaping holes in the hearts of families, friends, and communities. The outbreak of zoonotic diseases like Lassa fever, Ebola virus, avian flu, monkeypox, and lots more has more than ever necessitated the need for global health security, which has brought about the concept of One Health. One Health is about the collaboration between environmental health officials, players in the agricultural sector, and healthcare providers with the goal of achieving good health for people living in a healthy environment and having access to the right nutrition. Listen to the deliberations at the just concluded training workshop for media practitioners and public health communicators in Lagos to learn more. The program was put together by the Nigerian Center for Disease Control, NCDC, BBC Breakthrough Action, and USAID.
One Health is a concept. It's not really a new concept. It's an old concept, actually. But there is a lot of attention on it now because we have found out that majority of diseases that affect human are animal from the animal origin. About 75% of diseases affecting human beings are zoonotic diseases, which means these are diseases that can be gotten through animal and also some through the environment. And looking at this, having the animal health professional responding to animal diseases, human responding to the human part of the disease, and the environment doing theirs in silo doesn't really bring a well-coordinated form of response. So experts sat down around the table and agreed that it's better we bring all hands together so that we can respond as one team, and this is to ensure coordination of response, to ensure that we have an impact on the outbreak and ensure that we are able to control the infection quickly.
Communication is very key to that, and which is one of the strategic goals of One Health for the country. And to start, we need advocacy, and then we also need engagement, and especially with key actors as well as the general public, for them to know what exactly their roles are in preventing these zoonotic diseases. And more importantly, when there is outbreak, what they do in order to ensure that they keep themselves protected and then their loved ones.
From response to preparedness. So for risk communication is the exchange of information between the experts and the people at risk. And the essence is for people to be able to take informed decisions that will protect not just their health, their livelihood, their whole well-being. So that's what risk communication is all about. We also have another part of risk communication which really has to do with community engagement. So the whole portfolio is around risk communication and community engagement. And the community engagement piece comes to the fact that any response or any public health event or emergency really happens at the community level. So a whole lot of community participation, ownership is very important for us to address any public health event or emergency.
Intestinal worms or parasitic worms are simple organisms that feed off the human body. A person with intestinal worms may experience dysentery, an infection that causes diarrhea with blood and mucus in the stool. Intestinal worms can also cause several complications in children that present with the following symptoms: abdominal pain, loss of appetite, fatigue, weight loss, and nausea. To ensure that children are in good health and fit for academic activities, the Deworming Children of Air Force Primary and Secondary School Ikeja was a major focus for Nigerian Air Force Officers' Wives Association Logistics Command in commemoration of the 2021 Children's Day celebration.
Deworming a child or a person is more or less making the person healthy, because when the child or a human being has worms, you discover that at times even the person begins to emaciate. You can't really tell what is wrong with that child, because even as an adult, we are supposed to deworm, I think, once in 6 months, but we don't do that. So we have come today as a body to encourage this move, and I hope that after today it will be something that people will continue doing.
Beyond the deworming exercise, the students also went home with lots of gift items.
Presentation of uniforms, socks, school bags, school things for them, just to make life easy for them. Some of them we discovered, some are even orphans, some are widows, and we want to show them love this season.
Say no to drugs. So that's basically like the theme of the whole thing. Say no to drugs. The flight lieutenant that gave the talk on drug, told them about the things that make them take drug. He talked about pressure. He talked about curiosity. So things like that. Adverts at times, from advertisements, children see and they want to know what is. So we told them, you have to say no to drugs. No matter in what form it comes, your friend, your family, from whatever. Once it's not prescribed, you shouldn't go into it. You shouldn't take it.
The government of Australia has demonstrated interest in partnering with the Lagos University Teaching Hospital, LUTH, in healthcare management and research with the donation of medical textbooks on Monday, 7th June 2021. Coming at a time when the nation's health sector is challenged in the aspect of capacity building for personnel, the Chairman Medical Advisory Committee, Professor Larry Adeyemo, said the books will be put to good use.
22 cartons of books. I'm actually donating on behalf of my consultant, Dr. Olanewaju Nurudinakom, who is not in the country right now. And the reason why we are donating this book is that in the last 1 or 2 years, we discovered that there is a bit of lacuna in the medical-oriented textbook in our library. So, and Dr. Akom, having traveled to Australia, discovered that there are some books that we can benefit from them. And the reason why we are donating this one is that in donating this one, receiving it and making good use of it, we will also facilitate more donation down to this institution.
And I can assure you that these are books that are going to be very useful to the hospital, because apart from patient care, we are also involved in training of resident doctors, training of students in other fields, and also definitely also it's going to be useful also to our specialists.
Looking after sickle cell patients is a multidisciplinary thing. In the UK, for example, where I practice, they would have their own doctors, their own specialist nurse, their own psychologist, their own occupational therapist. All of those things come together as a package. And that is what we should be aiming for in Nigeria as well, to make sure that we deliver that level of care for them. Because it's not just the physical impact, is it? It's also the psychological impact.
Dr. Bolale Ido, who is also the coordinator of Azizat Olajumoke Gbero Foundation, did not just make her input to improve sickle cell patients' care in Nigeria, but matched her words with action by donating some state-of-the-art monitors to the management of LUTH.
This is presented to LUTH
on behalf of the Azizat Olajumokegbero Foundation.
Kind of gesture is actually really what we need if we really hope to improve on what we have already. You are aware that Nigeria being a developing country, and like any other developing country, we are resource challenged.
A lot of the time we tend to use manpower to monitor these things, but when you can use multi-parameter monitors to monitor them, especially during labor, during late pregnancy, when they're admitted, during delivery, it will definitely make a great deal of difference to their care.
The Passion for a Better Life for Sickle Cell Patients by Dr. Idu and her entire family was birthed by the death of her sister Olajumoke Gbero, who died of the disease at the age of 50.
They make about 1% of our pregnant population, and even though that seems a small percentage, the numbers we have in Nigeria, that's huge. And in pregnancy, they have a lot of complications. Some research that my team and I did, at least 70% of them will be admitted at least once during pregnancy for different things, whether it's crises, need for blood transfusion, malaria, sometimes chest infections, and something we call acute chest syndrome. All those things are certain conditions that they suffer from during pregnancy. They tend to have more of these things during pregnancy. And unfortunately, they are likely to suffer, to actually die or have the death of their baby.
Coming out of that, restricting yourself because of sickle cell disease. You know, there's no limit. The sky is not the limit for them. They can go on. My sister was a chartered accountant, and you know, she worked in several banks before, you know, she wasn't able to work anymore. So every sickler should have the opportunity to be able to attain the best or the maximum that they can. The life expectancy for the average sickler in Nigeria, I don't know what it is, but in the UK is about 50, really. So we still got a long way to go, even in developed nations. In developed nations. In America, it's about the same. It's between 50 and 55 years. That's their average life expectancy. I expect it's much lower in developing nations. And even that 50 is not even good enough. We need to keep pushing. There's a lot of research going on. Exchange transfusions, like, you know, for example, the normal way of doing it in the past was you just transfuse them. You just give them the blood. But we're moving away from that now to something called exchange transfusion, where you take out the blood that has the sickle cell in the one side and you give them blood without sickle cell on the other side. And the advantage of that is that you reduce the burden of the blood transfusion on the patient. And there's this equipment now where you can give them 6 pints of blood in under 90 minutes. A machine like that, if Luth had, say, even 5 or 6 or 10, would change the outlook for sickle cell patients in the community. But they're very expensive. Our desire is that one day we'll get there to be able to donate that. But if there are people, corporations out there, the exchange transfusion machine, it just makes a whole lot of difference to the care of these patients.
Sickle cell disorder, also known as hemoglobin S disease, is the most common inherited blood disorder. Nearly 90% of the world's sickle cell population live in countries like Nigeria, Democratic Republic of Congo, and India.
People should know their genotype, okay, before they get married and make this informed decision.
Babies born with sickle cell disorder usually show symptoms at about 5 months of age. These symptoms include anemia, pain crisis, swelling of hands and legs, frequent infections, and developmental delay. Welcome back. If you are just joining us, it's Etafe on AIT. Sickle cell anemia is an inherited blood disorder that has no cure for now but can be prevented. Nigeria is one of the developing countries that has the highest burden of the disease. Some Nigerians abroad are beginning to work towards improving patient care so that we can improve on life expectancy for people with sickle cell anemia. As seen in one of our reports, Dr. Bolanle Idowu is one of such concerned Nigerians. Beyond a report of donation to the management of the Lagos University Teaching Hospital, LUTH, I went the extra mile to speak with a consultant hematologist about sickle cell anemia disorder. She is Dr. Titi Adeyemo.
Sickle cell anemia is an inherited blood disorder. It is characterized by the red cells of the affected individual sickling when it is exposed to low oxygen, and then getting disfigured, and then breaking down much earlier before the end of their lifespan. Normally, the lifespan of a red cell should be about 120 days. But in sickle cells, because of the inherited abnormality which makes those cells to sickle, they don't last beyond 10 to 20 days. So because of this, the individual is usually short of blood, or what we call chronic hemolysis and anemia. And then also because those cells get disfigured, they become sickled and disfigured, they also tend to block blood vessels, causing what we call vaso-occlusion, which is the cause of the pain and the organ abnormalities or dysfunction that they suffer. The persons with sickle cell would go through a lifelong through life with episodes of what we call exacerbation crisis and episodes that we call steady state. Even during steady state, there's a lot of sickling and abnormalities going on in their body. But this is even further exacerbated during the period that we call crisis. They are going to go through life suffering from chronic anemia, chronic hemolysis, and eventually end organ damage and dysfunction. Okay, so as they grow older, some organs will start to become dysfunction and start to become problematic. So that is why you see higher incidence of kidney failures in people with sickle cell. You see higher incidence of stroke in people with sickle cell. You see higher incidence of liver disease. Every organs of the body can be affected. The eyes, the brain, the bones, every organs, the lungs can be affected. And then they have this period of intermittent crisis where they go through a lot of pain. This is also as a result of those deformed red cells blocking their blood vessels, okay, and then giving rise to pain in any parts of the body. So they go through a lot of pain. They go through blood shortages, and then they go through, as they grow older, organ dysfunction. So it's a lifelong chronic disorder. But of course, there is hope. Normally, the lifespan of a red cell should be about 120 days. But in sickle cells, because of the inherited abnormality which makes those cells to sickle, they don't last beyond 10 to 20 days. So because of this, the individual is usually short of blood, or what we call chronic hemolysis and anemia. And then also because those cells get disfigured, they become sickled and disfigured, they also tend to block blood vessels, causing what we call vaso-occlusion, which is the cause of the pain and the organ abnormalities or dysfunction that they suffer. Fortunately, it's reported in all literatures. Evidence has shown that 80% of people with sickle cell live in sub-Saharan Africa. Of course, majority of these 80% live in Nigeria. But it's also been documented that they have very high mortality rates below 5. So a lot of them die even before they reach the age of 5, contributing to the high under 5 mortality that we see in this part of the world. So they don't tend to live long, except they are diagnosed early, they receive the important care and attention that it requires, then they can live normal life as much as possible. But if we don't put those things in place to ensure that they are diagnosed early, before this organ complication sets in, if we don't put these things in place to ensure that they are protected from infection, these are the things that causes mortality in the under 5. So a lot of them do die before the age of 5, but for those that even survive beyond 5, they go through a lot of agony, a lot of pain crises, and organ function as they age. Well, sickle cell disease is a genetic disorder, so it must be inherited from the parents, okay? Inherited from an allele is inherited from the dad, and an allele must be inherited from the mom before an individual will have sickle cell. So what we advocate is that people should know their genotype, okay, before they get married, and make this informed decision. that these are the possibilities of having children with sickle cell, and if we do, these are the things that we need to do to ensure that they have the best life that they can. But they have to be aware of the implication of having children with sickle cell disease and the implication that is going to demand, and the demand is going to place on them in terms of finances, in terms of the care they have to give, in terms of the commitment that they have to give such children when they do have them. The main message is to the government. We need to put a sickle cell policy in place. We need to diagnose children with sickle cell disease as soon as they are born. We need to put in place the care that they will require as soon as they are diagnosed. We need to put in place support services when they have to seek care for their pains. They need a lot of transfusion, so we need people to donate blood so that they can easily have access to transfusion. They need to be protected from infection, so we need to put in place early diagnosis, proper health maintenance strategies in place so that they can survive and live normal life as much as possible. What has been done differently in other parts of the world? What they have done is that they are recognized as soon as they are born, so that appropriate care is put in place, so that they can survive to 5 years old and even beyond. Life expectancy to the age of 20 is almost 100% in other parts of the world, whereas it's less than 20% in this part of the world. And the most important thing, the most important lesson we have learned is what we call the newborn diagnosis, newborn screening. If we screen them as soon as they are born, they are recognized as soon as they are born, and then we can put proper care that they require in place, then they are definitely going to survive beyond their 5 years and even survive into adulthood and live a normal life as much as feasible.
My dear Lagosians, I am Dr. Ibijoke Sawolu, the First Lady and TB Champion of Lagos State. Do you know that 18 Nigerians every hour die of TB, and that more Lagosians are at risk every day? Tuberculosis spreads from person to person through coughing and sneezing into the air. Your health is a great concern to me. If you have been coughing for more than 2 weeks, having chest pain, tiredness, loss of weight, or night sweat, please visit the nearest health facility for testing and treatment. They are free. If you test positive, start and complete your treatment. Do not discriminate against tuberculosis patients. Let's support and encourage them to access free quality care. You can protect your family and community from the spread of tuberculosis. Go for the screening now and live a healthier life. Join the fight. End tuberculosis in Lagos. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe gbogbo wa ni.
Now, let's take you to our nutrition segment.
The lemon is a species of small evergreen tree in the flowering plant family, native to South Asia, primarily northeastern India. Lemon fruit is used for culinary and non-culinary purposes throughout the world, primarily for its juice, which has both culinary and cleansing uses. The juice of lemon is about 5 to 6% citric acid, with a pH of 2.2 giving it a sour taste. The distinctive sour taste of lemon juice makes it a key ingredient in drinks such as lemonade. Lemon promotes hydration. It is a good source of vitamin C. Lemon supports weight loss. It improves your skin quality. Lemon aids digestion and helps to prevent kidney stones. Experts recommend 1 or 2 glasses of lemon juice a day.
On our clinical segment, we give you tips for healthy living.
Every day you watch CNN, you see what is happening in India. They relax their methods. So the key thing is, yes, numbers are low at the moment, but as long as there are cases happening somewhere in the world, the threat remains, and we've got to keep up our level of preparedness.
We welcome your input on how to improve the nation's health sector and human lives on our perception segment.
Government should encourage the dental profession by ensuring that the oral health policy that was passed some years ago is fully implemented, so that every nook and cranny of this country will have a dental facility. We'll have about 774 local governments, I'm sure. There's nothing wrong in government having a standard dental facility in all the council areas to ensure that people access dental care.
Tobacco endangers all parts of the body, but mostly the heart and the lungs. And is out of 7 out of 10 cancer of the lungs is due to tobacco. So tobacco damages the heart, it increases the blood pressure, it causes heart attack, it damages some of the small vessels of the legs and can cause gangrene of the small vessels of the leg. It causes cancer of the lung, and even before cancer, it causes bronchitis. It causes infection of the lung and also promotes tuberculosis to endanger to affect the lungs. Have been promoted. And shisha is even 10 times more dangerous than tobacco cigarette. And our youth are now being caught up in also to be using shisha. Teach yourself to quit smoking, because once you start smoking, the individual is hooked upon it. It's not easy to stop smoking. Don't start smoking cigarette, and once you've started, you must commit yourself to quitting it.
It was nice discussing with you. If you enjoyed the program, please invite more people to join us same time next week. By the grace of God, I remain your regular anchor, Oshuomowa Daniels. Please stay safe.